My name is Stanislav Knyazkov. I'm Technical Officer of the WHO Regional Office for Europe. And it's my pleasure to greet you this afternoon and welcome to the high-level symposium on pharmacy care and pharmaceutical services. Without further ado, I'd like to pass the floor to our regional director, Dr. Hans Kluge, for the opening remarks, which will be delivered through recording. Thank you.
Excellencies, ladies and gentlemen, colleagues, it's a great pleasure to host you at the UN City in Copenhagen. We are holding the symposium in the run-up to World Pharmacist Day, an occasion to appreciate the multidisciplinary expertise of pharmacy professionals. An expertise that ranges from managing medical products throughout their life cycle to dispensing these products to patients and supporting their appropriate use and safe disposal. But we are here also, and especially, to underscore the essential role that pharmacists play in caring for patients, promoting health all the while, knowing and fully understanding their communities. This celebration gives us an opportunity to take stock of how the pharmacy profession has evolved over the years and how pharmacists have become trusted providers, helping address some of the most common ailments. I want to recall for a moment the lessons we learned from the COVID-19 pandemic, when pharmacists played a key role in providing guidance to patients during times of great uncertainty. When pharmacists, together with other frontline health workers, were the first responders. When pharmacists stepped in to support care for chronic patients while fully participating in the search efforts for pandemic response. And when pharmacists, together with other health professionals, such as nurses, played a key role in rolling out life-saving vaccines. Today, while it's clear that the role of pharmacists is important, we have a long way to go to truly unlock their full potential as frontline healthcare professionals and members of multidisciplinary teams. This high-level symposium, co-organized with our partners at the International Pharmaceutical Federation, is part of our efforts to explain to the wider world the role of pharmacists and to place their needs and aspirations under the spotlight. The WHO European region enjoys some of the best medical and pharmaceutical schools in the world. Hundreds of thousands of passionate graduates embark on this journey every year. And at a time in which the region still struggles with shortages of health workers across the board, we must better maximize the role of pharmacists. As you get ready to discuss these important issues today, I would like to personally thank all pharmacists in this region and everywhere for your commitment to caring for patients in your communities.
Big thank you to the regional director for underlying specifically the link between pharmacists and healthcare delivery. And I think this subject is very close to the heart of our next speaker, Professor Martinez, right, who spent her entire professional life in providing this interface between pharmacy and other clinical professions. Professor Martins, would you like to share with us how this plays out in Portugal? What are the achievements and challenges? The floor is yours. Thank you very much.
Thank you so much. In the following lines, I have some notes, but I will try to share even before the panel what are our goals in this government in Portugal at this stage, mostly for our pharmacists. So, esteemed representatives of the International Pharmaceutical Federation and the World Health Organization, distinguished colleagues, and honorable guests. It's an honor to be here today, representing Portugal at this high-level policy dialogue. Pharmacy care and pharmaceutical services are essential pillars of our healthcare systems. They directly contribute to the well-being of populations and the sustainability of healthcare systems globally. I welcome this opportunity to share Portugal's recent achievements in pharmacy care, discuss our current challenges, and explore how international collaboration can propel us forward in addressing these challenges. In recent years, Portugal has made significant strides in expanding and strengthening pharmacy care services, making the pharmaceutical profession a cornerstone of our healthcare system. One of our key achievements has been the enhancement of pharmacists' roles in both hospital and community settings. Pharmacists have increasingly been integrated into healthcare teams, ensuring more comprehensive medication management, patient counseling, and the prevention of medication errors. The technical expertise, particularly in rational and safe use of medicines, has contributed to improve therapeutic outcomes and patient safety. We are especially proud of our pharmaceutical residency program, launched in 2017, which has provided a structured and rigorous path for pharmacists in hospital healthcare, clinical analysis, and human genetics. This postgraduate training guarantees that our hospital pharmacists, as the physicians, are equipped with the in-depth transversal knowledge needed to navigate the complexities of modern healthcare. Another significant development is the expanded role of pharmacists in vaccine delivery, particularly during the COVID-19 pandemic. Community pharmacists played a vital role in Portugal's vaccination campaigns for COVID-19 and influenza. Over 70% of the population aged 65 and over received the vaccines at pharmacies. This initiative not only increased vaccination coverage all over the country, but also improved citizen satisfaction and accessibility to vaccines, showing the essential role that pharmacists can play in public health. Additionally, in community settings, we have been consolidating pharmaceutical services with medication reviews, home support, and the provision of point-of-care testing. These advancements have alleviated pressure on other healthcare sectors, notably general practitioners and emergency services, while empowering citizens to managing their health through self-care and preventive measures. The advances in pharmacy care in Portugal align directly with the overarching objectives of our national health system today. At its core, our health system strives to improve patient outcomes, enhance access to care, and promote cost-effective interventions, and ensure, of course, the sustainability of system in the face of rising healthcare demands. So pharmacists play a pivotal role in achieving these objectives. Their involvement in medication management ensure that medicines are used in a rational, safe, and cost-effective manner. By optimizing therapeutic outcomes and reducing adverse drug reactions, pharmacists not only improve the quality of care, but also contribute to controlling healthcare costs, so critical in times in constrained budgets and resource limitations. Furthermore, pharmacists are at the forefront of curbing antimicrobial resistance, a priority for both Portugal and the global health community. Through antimicrobial stewardship programs, the Portuguese pharmacists ensure appropriate antibiotic use, helping to preserve the effectiveness of these vital treatments. Their involvement in national campaigns to promote generics, biosimilars, and robust IMR strategies, as I said, is an essential part of safeguarding the future efficacy of our medicines. In the realm of chronic non-communicable diseases such as diabetes and hypertension, asthma, and cardiovascular conditions, pharmacists have become integral to prevention, early detection, and management. Pharmacists assist patients in managing their medication plans, providing education on how to use devices like inhalers and glucometers, and ensuring that treatments are followed correctly. They work in offering screening services, providing lifestyle advice, and ensuring medication adherence helps a lot to alleviate the burden these diseases place in our healthcare system nowadays. This extension of services allow pharmacists to act as a frontline healthcare professionals, providing clinical and accessible care across the country. The current challenges that we all are facing, and also pharmacists with us, is that despite this success, we still face several challenges in fully realizing the potential of pharmacy care and pharmaceutical services in Portugal. We can do much more. One of our most pressing challenges is the ongoing shortage of healthcare professionals, which includes also pharmacists. As the scope of services provided by pharmacists continue to expand, there is an increasing need for specialized training. The issue is part of a broader global problem of human resource constraints in healthcare. Pharmacists must be prepared to take on more complex roles in patient care because we need them for that, for providing clinical services to managing chronic diseases. Furthermore, attracting and retaining skilled pharmacy professionals in rural regions continues to be a significant challenge, but we need them so much also there. Another challenge is the need to further integrate pharmacists into the broader healthcare system. While significant progress has been made, there are still gaps in fully realizing the potential of multidisciplinary care. Ensuring that pharmacists are recognized as an essential members of healthcare teams, not just in hospitals, but also in primary care and community setting, is also vital. While pharmacists are playing a more active role in healthcare, there is still a need for, as I mentioned, better integration with other healthcare professionals, namely family doctors and nurses, mostly to the management of chronic and multiple conditions. This government, where I serve as health minister, has prioritized expanding the role of community pharmacies in the health sector emergency plan framework. The goal is to make better use of the pharmacy network within the healthcare system, ensuring that they are more accessible to citizens and provide specialized care. This is something that is already in progress, but we keep going. Like many healthcare sectors, pharmacy care faces financial sustainability issues. Although pharmacists provide a wide range of services, there are still questions around reimbursement for these services. Ensuring the financial viability of pharmacies, particularly those in rural areas, is crucial to maintain equitable access to healthcare across the country. Portugal has been at the forefront of digital health innovation, and pharmacy care is no exception. Actually, our pharmacies network are much more, I would say, advanced than when we compare with other healthcare units of the health system. Many people continue to see pharmacies purely as places to get medication, rather than a comprehensive healthcare center that can offer preventive care, consultations, and health management support. The challenges we face are not unique to Portugal, I'm sure, and we will share probably in the panel what we are all facing across Europe and globally. And we know that countries as us are grappling with similar issues, and this is why international collaboration is so critical, and for us and for this government so important to be here today. Through collaborations with the International Pharmaceutical Federation and the WHO, we can share best practices, learn from each other's experiences, and work towards common goals. For instance, through international cooperation, Portugal has benefited from the latest research and innovation in pharmaceutical care, enable us to adopt evidence-based practices more quickly. We are also keen to contribute to and benefit from global efforts to combat antimicrobial resistance, as I said previously. By participating in multinational initiatives, we can develop more robust antimicrobial stewardship programs and implement cross-border strategies to monitor and reduce resistance patterns. Furthermore, and I'm almost ending, as we move into digital age of healthcare, international collaboration is essential in ensuring the standardization and interoperability of health technologies. Working with our European partners and other global stakeholders, we can develop systems that allow pharmacists to make full use of digital tools, improving both patient outcomes and system efficiency. Finally, pharmacy care in Portugal, as in any other country, must be prepared to respond to global health challenges such as pandemics and antibiotic resistance. Closing my notes, I would say that pharmacy care and pharmaceutical services are indispensable components of our healthcare system in Portugal. And this was already recognized by all the political parties from left to right. As we look to the future, our goal is to continue building on the progress we have made, addressing the challenges we face, and working collaboratively with the international community to create a sustainable and resilient healthcare system that serves the needs of all citizens. So I would finish thanking you for your attention, looking forward to further and fruitful discussion during the day, and also greeting you all, and many thanks for having us today.
Excellent. Thank you so much, Minister, for this very rich keynote address. You have touched on so many important points, but I wanted to single out one particular aspect, which I think will make an excellent segue to our next distinguished speaker, because The speaker combines the expertise of the family doctor, public health professional, and also the knowledge of medicines and health economics. I speak of none other than Mr. Javier Padilla, and I invite you to take the floor. So, Dr. Padilla, what are the dynamics between the healthcare system and the pharmaceutical sector in Spain? Can you show your insights?
Thank you. Thank you very much. It's really an honor to be here with you all, and especially speaking after the Minister of Portugal. I don't know if I can really add something else after her intervention, because it's been really holistic, but also going to the specifics. So thank you very much. It's been great to hear from you. So I think that we have some shared challenge between all the countries in Europe, but specifically between Spain and Portugal. In Spain, we have a pharmacy model that I think that we are really proud of it, and everything we want to intervene on it should be trying to guarantee that we are really caring for our model. I think it's a model based on the very good distribution, on the pharmacies arriving to every single village in our country, and really working together and really near and open to the community. I think that in the last years, during the COVID, it was very obvious that the collaboration between the institutions and the community pharmacies were really close and really adding some value to the patients. It was also with the face mask and test distribution, with the symptoms detection and the openness to population, when really, even in the healthcare providers, this openness was not so obvious. And also with the information given to the population, trying to stop the spread of non-scientific information related to trying to gain some confidence on the vaccine, on COVID vaccine, trying to fight against the vaccine hesitancy. But also, I think that there have been many other experiences in the last year, not only related to COVID, but related to some other population health challenges. For example, pharmacies collaborating with the gender violence detection and trying to direct these women to the correct providers in order to prevent and to act when it has already been established. And I think this is something very specific and that should be outlined. But I want to talk about something that has been happening in Spain, I guess all around Europe, but in Spain especially, about the changing role of the pharmacist all around the health system. For instance, in pharmacists working on hospitals, there have been changing to a role with a more complex role in how to produce and to prepare the new the new medicaments, especially related to biological drugs. So I think that the role of pharmacists in hospital has been like a changing role, but also at primary care. I think that 1 decade ago, primary care pharmacists in Spain were very related to the rational use of medicaments, and they were working very tightly with the management level. But nowadays, I think that at primary care, pharmacists are working at the clinical level, are working with medicaments management and the polypharmacy. And I think that this is like the door through the future actions related to primary care and pharmacists is going to be directed. And we have the three group that are the pharmacists working at the community pharmacists. And here, I think that we have some challenges ongoing that we should face. I want to announce today, the day prior to the International Pharmacists Day, that we are going to conform a working group in order to work on a consensus paper of the community and care provider pharmacy in Spain. We really want to update the role of the community pharmacy in our national health service, and we want to try to create a new consensus, to have a new ground, to develop the new initiatives, and in order to be able to provide the best care for the patients with the best evidence-based interventions, but that with having the possibility of having the experience of the benchmarking of different initiatives that are already ongoing at a European level, but especially at a national level. And we want to work together with the different actors, not only people working on the community pharmacies, but also in the academy, also in primary care, and many different positions. So this is something that I hope in the next 3 or 4 months we will be able to have like a new framework for this care provider pharmacy in our country. Also, I think that we are now working in some new laws, and one of the things that we are going to incorporate is something related to the capability of the pharmacists at the community level to substitute different drugs when we are in a situation of shortages. I think this is something not only that should be done because of efficiency, but very especially because of respect of the level of instruction that our pharmacists have. If we really have high-level instructed pharmacists in our country, we really should have the responsibility in order to make them be possible to acquire these competencies and these responsibilities when working with patients. In this law, we are also trying to incorporate the creation of what we call the coordination committees for pharmacotherapeutics. We want to create a committee at a primary care level, at a district level, at a real basic health center level that place together the people who are prescribing, the physician, the nurses, the people who are providing the drugs, the pharmacists at the community level, and also the people who are doing this epidemiological surveillance level with drugs, and everything coordinated by primary care pharmacists. So we want to create these committees because I think that the best way of making that pharmacists are a part of the teams is recognizing them as a legitimate member of the dialogue towards and around the pharmaceutical work in primary care level. And in the last place, I want to say we are also working towards incorporating pharmacy, the community pharmacy level in our new primary care action plan that will be passed through December this year, and we will want to incorporate some concrete interventions, especially related to the communication between the primary care providers and the community pharmacists. I think that nowadays, in the 21st century, that we are communicating by WhatsApp, by Telegram, at every moment, it's not possible that we really don't have really good ways of communicating between the people who are working with our patients, that are those who should be in the center of our efforts. So I think that we are in a moment nowadays that we should be very conscious that the pharmacies in our country are one of the motors of equity in health. They are present all around in our country. They are many times open even more hours than primary care providers. And I think that we really should see them as private facilities that are providing a public service. So we are really working towards to make this like a higher value in our health system. We also already have some challenges. Some of them are shared with Portugal, for instance, but I think that we have also some concrete ones. The first one is trying to create a higher amount of services provided by pharmacists, but maintaining this view of equity and as one of the main values we want to maintain. We think that one of the ways that we have to be working on to guarantee the sustainability of rural pharmacies is by means of healthcare pharmacy services. I think that we should be moving forward to a product-centered practice, to a service-centered practice. But that thing is going to make us talk about something that not everybody wants to talk. It's about financing. we really have a product-centered financing system in Spain. So we should start to be able to talk about how to finance pharmacies in order to incorporate not only the product center, but also the service centered. I think it's crucial in order to guarantee the sustainability of pharmacies, especially in rural areas and some other areas where sustainability cannot be guaranteed. So I want to end not only thanking the celebration of this high-level policy dialogue, but also trying to say that I think that this kind of events should be like the push that we need in order to move from evidence-based interventions to real action in order to be able afterwards to evaluate and go on with sharing this action with all the rest of the countries, always with a view very fixed on the equity in health in our societies and on the needs that patients have. Thank you very much.
Great. Thank you so much, Dr. Padilla, particularly for having very concrete and practical asks from pharmacists, I guess, that you have voiced on behalf of the entire health system of Spain, right? Sometimes some people, maybe in other professions, might think that such a huge range of practical tasks might be intimidating for one profession. But I know that pharmacists are not intimidated, because, of course, we as practitioners can rely on WHO and on our professional associations. And that's my pleasure to invite the representative of the International Pharmaceutical Federation, who is working on shaping the pharmacy practice across the region, Mr. Luis Lourenço. If you could please join us on the stage and share the insights that you have on how FIP does it. Thank you.
Thank you so much. Dear Professor Ana Paula Martins, Minister of Health of Portugal, dear Xavier Padilla, Secretary of State for Health of Spain, esteemed representatives of the World Health Organization Europe, honorable guests, distinguished colleagues, ladies and gentlemen. As a result of the developments on human health during the last few decades, today we live longer and most of the times better. And that's extraordinary. However, this longevity and vitality increasingly puts pressure on healthcare systems since patients need more care, resources, and investment over time. In 2023, the World Health Organization's 53-member European region members were on short an estimated 1.8 million healthcare workers. That number is expected to climb to 4 million by 2030 if nothing is done to correct its course. So how can we contribute to more sustainable healthcare systems in Europe using the available workforce resources? One of the solutions is to allow healthcare professionals to exercise their profession to the fullest extent of their capabilities. That is, to do everything their training allows them to practice. Another is to increase access to healthcare through task sharing. That is, having certain tasks shared among healthcare teams to the benefit of the patient. FIP, the International Pharmaceutical Federation, represents more than 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators through the membership of organizations that cover more than 160 countries. Our vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and healthcare technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration with other healthcare professionals. FIP collects and shares good pharmaceutical practices, creates competencies frameworks, empowers pharmacists and their professional organizations, and promotes the pharmacy's role on healthcare through institutional relationships. It is the ideal structure to present how pharmacists working in community and hospital pharmacies can unlock their full potential and how around the world have been contributing to reduce pressure on healthcare systems by expanding scope of practice and task sharing. In the area of prevention, a case of enormous success is pharmacy-based vaccination. We have seen an exponential increase year after year in the number of countries and jurisdictions that allow vaccinations by pharmacists and or in community pharmacies. Countries like Portugal and Ireland were pioneers in Europe more than 15 years ago, while the pandemic has accelerated its implementation in other countries like in Italy and Poland. And contrary to those who have thought with the establishment of pharmacy-based vaccination that vaccination rates of other healthcare professionals would be reducing, actually they have increased significantly, meaning that more patients in more areas in a shorter time get vaccinated. This expanded scope of practice can help countries having a robust and efficient life course vaccination strategy. We have also seen the involvement of pharmacists in the management of mild clinical conditions. We're seeing an increasing number of countries where citizens, when experiencing a mild clinical condition, a sore throat, a earache, an urinary infection, for instance, are encouraged to go to the pharmacy, where through the application of clinical protocols agreed with healthcare authorities, the pharmacist can provide advice and dispense medication if necessary to solve their clinical situation. These services reduce the burden on hospital emergencies, freeing up resources so that more complex clinical situations can be treated more quickly. Right next door in the UK, the Pharmacy First project is a great example of this service. The work of pharmacists in fostering health literacy and adoption of healthcare of healthy lifestyles has been long recognized, as well as the role of helping patients managing their chronic conditions. But we definitely can do more. In several countries, you see chronic medication renew services being implemented in pharmacies, where pharmacists renew medication after confirming that the health condition of their patients is under control. We also know that chronically ill people tend to consume more medications. That's why pharmacists have increased their range of action by carrying out medication reviews and medication reconciliations when users go to or leave secondary care. Which brings us to the contribution that hospital pharmacists can also make to the efficiency of healthcare systems. On top of the traditional activities carried out by our colleagues in hospital, as the production of medicines, sterile preparations, nutritional mixers and other products, the optimization of distribution and administration of medicines, and the definition of procurement policies and protocols, we are seeing hospital colleagues expanding their scope of practice by promoting responsible and evidence-based prescribing. I just mentioned the importance of this in combating antimicrobial resistance, promoting the responsible and rational use of medicines, and performing pharmacotherapeutical follow-up on patients in horizontal collaboration with the entire clinical team. It's paramount that hospital pharmacists can also train and collaborate with nurses to ensure safe and correct medicines administration. Data shows that 38% of preventable medication errors occur in administration, and that 40% of nurses' time is spent administering medications. I could literally spend the rest of the afternoon going through examples of the extraordinary work that the pharmacists are doing across Europe and the world by expanding their scope of practice and by task sharing. In order to have all these examples registered, compiled, and hopefully implemented, FIP launched last May, during the World Health Assembly in Geneva, the Think Health, Think Pharmacy campaign. In our first campaign publications, for instance, we recall that the work of pharmacists during the pandemic. We learned that in France, by December 2022, more than 50% of COVID vaccines were administered in pharmacies, For that, from November 22 to April 22, more than 12 million COVID tests were carried out in pharmacies in Portugal. We invite you all to learn more about this campaign and explore the brave new world of pharmacy. By now, you must be thinking, aren't there more pharmaceutical services available in our countries? Why the scope of practice of community and hospital pharmacists is not expanding in some jurisdictions? In order to tackle this question, we need to explore the three components of professional practice implementation. I'll mention them not by order of importance, since the three need to be fulfilled in order to see change in practice. The first component of implementation is training. It is only possible to implement a professional practice if pharmacists are trained, competent, and confident in their role. I'm tempted to say that this component might be the simplest one to achieve, not because it is of minor importance, but because, for example, FIP already develops training manuals, collects the most robust worldwide evidence of pharmacy practice, and shares it with all the national members. The second component is regulation. We can have well-trained pharmacists qualified to follow best practices, but if the regulation, the legislation is not clear and unreservedly mentions the role that the pharmacist can perform, we will not be able to have a change in practice. This applies not only to national legislation, but also to hospital and other healthcare facilities regulation. And finally, the third component is financing. We can have well-trained pharmacists practice under a clear and explicit regulatory framework, but without appropriate financial incentives, we cannot have an effective, equitable, and sustainable change in professional practice. Training, regulation, and financing. These are the three components of pharmacy professional implementation, and I challenge you all right now, either you are the governmental officer, a member organization representative, or a practitioner, to reflect on how can you contribute to the development of the profession for the sake of our patients. Am I providing the training and I'm fostering the skills that pharmacists need to perform more? Do I set clear regulations in my jurisdiction to provide the governance needed by pharmacists? Am I advocating for financial support for new rules of services so that they can be sustainable over time, that are equitable to the citizens I represent? Your answers and what you do with them might make a big difference in someone's life. Someone who wants to live longer and healthier, someone who can be an anonymous citizen, an acquaintance, a close relative, someone who knows maybe one day might be you. In summary, as a result of the development of health systems and their different components, we live longer, and so we want better. There is a general lack of healthcare professionals to respond to the needs of the population. It's important to promote their full scope of practice and promote task sharing between healthcare professionals. Professional development has three components: training, regulation, financing. FIP is committed to assist international and regional institutional, our member organizations and partners, as well as practitioners worldwide to develop pharmacy practice. There are examples and proofs of concepts across Europe and the world where pharmacists play a decisive role in providing the efficiency of healthcare systems. One-size solution might not fit all, but there is always one solution that will fit your needs. Count with FIP to count with your answers. Count with FIP to be part of the solution. Thank you.
That was excellent, Mr. Lorenzo. And big thank you to FIP, who is not only our partner in many activities, including this meeting today, for being there for pharmacists and advancing the frontiers of the pharmacy care. Mr. Lorenzo, you are a community pharmacist, aren't you? Well, that's, I don't know, in addition or the basis for your professional role of the professional secretary of FIP. I don't know if our esteemed participant noticed the pattern, but I find it very symbolic that here on this stage we have pharmacists and medical doctors standing side by side and saying that we need to continue working together for the benefit of the patient. I don't want to ruin this pattern. So that's why I would like to invite another medical doctor, the family medicine doctor, who is also my dear colleague from WHO, Dr. Thomas Zapata, who is the regional advisor for the health workforce and care delivery. Dr. Zapata, it's over to you.
I think we ruin it a little bit because Javier and I, we are family doctors, both of us, so it's a little bit unbalanced here. But anyway, so I would like to start by congratulating many of you because tomorrow is the World Pharmacist Day and many of you are pharmacists. And also we have pharmacy students from the Copenhagen Pharmacy School. So congratulations to all of you because I think you are the future. It was really nice to see you all here in the UN city. So welcome and congratulations. And then the main purpose of I'm going to do a presentation and seems to be working, which I think we are improving, we are learning. So the main purpose is to give a flavor of what is the health workforce situation in the European region. I think some of you have already seen it, but can you put it in presentation mode, please? So we're going to start with this report that we produced a little bit more than a year ago, Health and Care Workforce in Europe, Time to Act. And this report presents some data showing what is the health workforce situation in the countries. And it does contain data on pharmacists. So I think it's really rich. If you have a chance to go through the report, you will see that it has 53 country profiles that contains data on pharmacist density and production. So you are able to compare different countries, which I think is interesting for you. Then the report made a lot of headlines, and these headlines in different newspapers is basically because many countries in our region are really facing shortages, a health workforce crisis. There was a recent paper showing that the number of strikes of health workers have increased 20% before and after the COVID pandemic. So we really have a situation, and that's why the report captured a lot of media attention in different newspapers, including The Guardian, which took our press release, which was a ticking time bomb because of the aging and because of the mental health of the health workforce, as we will see. But what is the situation? What we see is that we have more doctors than ever. There has been a 20% increase in the past 10 years. We also see that there has been an 8% increase in the density of nurses in the last 10 years. But we also have to be specific, because when we look at GPs, for example, we see that in 17 countries, there has been a reduction in the density of GPs. So we cannot just look at the overall numbers, we also need to be more specific. And I'm bringing the GP here because it's really much linked to the community pharmacists and the role that pharmacists can play in primary healthcare, as Javier was saying before. So when we look at the medical graduates, again, we have an increase, 37% increase in the medical graduates. When we look at the nursing graduates, it's a 26% increase across the region, across the countries. And when we look at the pharmacists, we find a similar pattern, a 16% increase in the density of pharmacists across the region. And when we look at the production, it's a little bit more, not that sharp increase, but we also have a slight increase in the production of pharmacists. And then I think we need to bring the gender dimension and recognize that 75% of the health workforce are women. And I think it's really important as well that only 30% of leadership positions are occupied by women. And also that we have a 24% gender pay gap. And I really encourage you to read the gender pay gap report by our colleagues in WHO headquarters in this direction. So I think this is also important that we think about these things when developing policies. But the key question here is, why, if we have more doctors and nurses and pharmacists than ever, we are having a crisis. Why we in the European region is the region with the highest density of health workers in the whole world, we are still facing shortages. That's the key question. And I'm going to try to respond that by looking at the availability of doctors, this blue cycle. And the first factor that is pushing down the availability of health workers is aging. And we see that we have a very old workforce, especially for medical doctors. On average, 30% of the doctors in the European region are over 55 years of age. But in 13 countries, more than 40% of the doctors are over 55 years of age. That means that in the next 5-10 years, 40% of the doctors will go on retirement. So that's really stretching the health systems and is really putting under pressure health systems. The second one, we put here the health workers' deaths, because that had a profound impact in the mental health of the health workers during the COVID pandemic. And we were discussing during lunch with the colleagues from FIP that health workers were already kind of really up to the maximum, up to the top of in terms of capacity. And then with the COVID pandemic, at the end of the day, it was a really over workload and overburden, and that has implications also on the mental health of the health workforce. We also have migration, but I'm not going to get into that, but that's a factor that is affecting different health professionals. And then the resignation. What we see is that many health workers, more and more health workers are leaving the health profession. And this one is when mental health is playing a role. When we are looking at burnout, different studies, around 40 and 50% of the health workers experience burnout, more health professionals comparing to other professions, more women, more doctors, more nurses, and other professionals. And pharmacists were discussing with FIP how we can really look at the mental health of the health workforce of pharmacists as well in the European region. And on the other side, what we see is an increase of the demand for services. First of all, because of an aging population. And I think this graph is really important. In 2024, the number of people over 65 years of age in the European region surpassed the number of people under 15 years of age. And it's growing and increasing, as you can see in the green line. And also important, the population over 80 years of age, because all this is really putting a lot of burden in care services into the system. And this is really also stretching and challenging the health systems. So then we also have the increase of chronic diseases. We have also the backlogs generated during the COVID pandemic, and then we have an increased demand for services, what I call consumerism by patients, that we also need to handle and see how we manage that one. So at the end of the day, what we have is an increased demand for services that is growing at a faster pace than the increased supply of health workers. And that's what is creating the gap, and that's what is creating the shortages, and that's what is creating the crisis on health workforce that we are having. So as WHO, we went for the Bucharest Declaration. All countries in the region, 50 countries in the region were there, collaborating centers, professional associations. We were all there, 300 people in Bucharest, and we signed the Bucharest Declaration, which was a really intention to really elevate the health workforce agenda into the central political stage. Because we always talk about health workforce as being the cornerstone and very important, blah, 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 but it's always kind of not important enough. And this was the opportunity to come together and try to really reposition this after the COVID pandemic and the new challenges. And then we developed a framework for action with all 53 member states. And we were also discussing with the colleagues from FIP during lunch that we managed to put into agreement and sign a resolution between Russia and Ukraine, between Azerbaijan and Armenia, between the European Union and Russia. And we agreed that we have a common denominator, that we had to improve the health workforce in our region. And all 53 countries in our region signed that resolution and that framework for action. And this is the framework for action. And the framework for action is really putting health and care workers at the center. Is putting retaining health workers at the center. Is how we can keep health workers in the system so that they don't leave. And for that, we need to improve the working conditions. We need to reduce the workload. We need to improve remuneration in many cases. We need to improve the work-life balance. We need to make it more attractive for the for the new generation. So it's attractive to come into the health sector. But second, and I think where I want to focus today, is that we need to optimize the performance. As I was saying before, we have more health and care workers than ever, but still is not enough. So I think we need to reconsider, we need to rethink how we organize and provide services, because we cannot keep increasing and increasing. We need to rethink how we provide services. And in that is critical redefining the teams, redefining the skill mix that you all were talking about. It's about how, in this case, pharmacists, for example, can play a more advanced role and expand the scope of practice so that they can provide services to the community, as you were discussing before, in different elements, as we will see later. And that's one key element in contributing to that way of rethinking services. Nurses can also play an advanced role, a different role, an expanded role, and we have to go in that direction. The second element is how we reorganize patient pathways, how we reorganize care, how we put patients at the center so that we can really minimize wastage and maximize effective care to patients that is not harmful for patients. And the third one, I would say, within the optimized performance, is how we can bring digital health technologies, assisted AI, and all the advances, innovations into healthcare as a complement for health workers, not as a substitution. So I think this key pillar on optimizing performance, I think pharmacists really play a really important role in the skill mix, but also in innovations in technologies, as you were describing before, that in Portugal, in some cases, is more advanced from a digital perspective in the pharmacies practices. And then the last two is about education, how we build the supply, but also very important, how we better plan the health workforce, how we anticipate future needs. Why we have such an aging workforce at the moment? Because there hasn't been a simple planning process before that we were anticipating that there was going to be a wave of retirements of different professionals over the years. Now nurses are much younger, but if we don't do anything, we will end up in a similar situation in the next 10, 15 years. So we need to be proactive. We need better data. We need bringing all the stakeholders together, including pharmacists, including all professionals, to really plan for the future and really think proactively in the future. And then it's like playing with the... So then this paper, I think we printed some copies, is trying to summarize the role that pharmacists could play in this kind of transformation, in this kind of change of how we can reorganize services. We published it today in the Lancet Europe, and if he's trying to bring some of those elements, and you have already discussed very concrete examples in Spain, Javier, in Portugal, and also FIP has bring many of them. But not only medication therapy management, but also in terms of chronic disease management and the front line, as you mentioned in your intervention, vaccination services during the COVID pandemic. It was really explicit here in Denmark. We are all familiar that pharmacists were delivering vaccines, health screenings of different types, tobacco, smoking cessation, and all different types. Public health campaigns. I mean, the scope is really wide in this. And I'm looking at Lourdes because we were discussing, and some of these ideas come from you. So I think there is a lot of potential in making it happen. And I think it's really interesting to see how Spain is going in that direction, how Portugal is going in that direction in a concrete day to really make this happen. And I think at the end of the day is how we can work everyone as a team and bring in a health system that is bringing all the pieces together in a harmonized way, an integrated way. So just to finalize, I want to finish with a positive message, which is what we try to convey in this paper, which is how we move all together from a health workforce crisis to health workforce success. I think we have to forget about the narrative on a negative way, on the crisis, on the problems, and we really need to move forward into solutions, into concrete actions, and how we can bring all the different stakeholders, pharmacists, doctors, nurses, public health, how we can bring different ministries together, education, finance, labor, health, together so that we can really align in moving in a direction that we can strengthen the health workforce in our countries, so that at the end of the day, we can provide better access and quality of services to improve the health of the population. And I think it's really important what Javier was saying, having the lens of equity in mind. And we are in WHO, and that's really important for us, that we are not leaving anyone behind, especially those who need it more. Thank you so much.
That was excellent. Thank you so much, Dr. Zapata. I think it's helping also, finishing on the positive note, that we are not only on the eve of the World Pharmacist Day, but also that pharmacists are happy and ready to extend the helping hand and try to bridge some, maybe not, but some of the gaps that we face in health workforce, of course, as the competences and skill sets allow. And in my presentation, I'd like to think or reflect together with you on how we can make this a reality, how that would be possible. And I'd like to start, first of all, from the reminder that at the turn of the century, our health systems adopted a new mode of operating, placing the person, the patient, at the center of all our efforts. And that has implications for pharmacists too. Why? Because we do not accept the notion that pharmacists are something else. Pharmacists are healthcare professionals for us. And that's why we need to align with this. You see the 5 strategic goals that the World Health Assembly put forward in 2016 in order to implement this vision of person-centered healthcare. And you can see that many of them apply to the pharmacy practice. The first one, placing the person in the center, meaning helping the person to make choices for health, even before the health-seeking behavior starts. Accompanying the patient through his or her journey towards restoring or improving health, but also empowering communities. Of course, we come from a certain perspective, the perspective of being the experts in products. But this perspective is also increasingly important. And we see that it's not only, dispensing or handing the product over the counter. It's actually much more in accompanying this product towards the effectiveness that it's supposed to produce. And that means collaborating with other healthcare professionals. And that speaks to the 4th coordination goal. Also being a partner, not only at the community, but also at the hospital level. And that means working with other healthcare professionals in the 2nd and 3rd tier of our health systems. And in the next slide, let's try to think how we can implement this vision. What does this patient or person centricity mean for a pharmacist, or the pharmaceutical profession in general? I think somebody mentioned that we replace our focus on products with a focus on a person. Would that be proactive? Would that be resultful for producing the results that the health system, modern health system, wants us to help achieve? Let's take a look at the next slide that tries to formulate the 1, 2, 3, 4 vision. which tries to include in these 4 digits, 1, pharmacy profession, with dual focus on both patient and products. And I mean that we don't need to lose our expertise in products in order to bring this patient-centered approach into our pharmacy practices. We need both of them. Is it too much to ask? Well, I dare say no. And the 3, standing for 3 modalities, help us to envision how that would be possible to implement this, where I have already touched on the pharmacist being the orienter or the guide of the patient towards health. And this is the modality for the patient centricity. We also accept the second modality, right, as something that we associate pharmacists with, the modality for delivering products, ensuring their availability, ensuring their affordability, rational and cost-effective use. But I specifically do not emphasize medicines only. I say products in a broader sense of this word, because in the second modality, we need to make other products available to the patient. Medical devices are indispensable products for the 5 dimensions of healthcare: prevention, diagnosis, treatment, palliation, and rehabilitation. And that's why we as pharmacists are not supposed to lose medical devices, assistive products from our side. But making them available is not enough. I mean, it's a traditional, right, widely accepted practice. But guiding patients how to use them, all right? And this is particularly important not only for medicines, but also for medical devices, because a device needs to be correctly applied, right? The person needs to have the skills of applying this. And that means accompanying patients in self-care. And in the third modality, we try to formulate another need. It's not enough to stay on the level of the showing, of the demonstration of how to apply products. But in certain cases, when the patient needs this, we need to deliver the service, applying medicines or medical devices in order to achieve the necessary health result. Yeah. And one of the examples, you will see an example with the blood monitoring in one of the posters that we have available for the face-to-face participants in the exhibition and the lounge. I would like to evoke an example of blood control, right? It's not evident for each and every person how to correctly use the tonometer, how to make sure if the tonometer that the person has at home is working, right? So that means there is a need for demonstrating and even sometimes helping to maintain products, right? And then some persons need healthcare professional to take the blood measurement for them because for various reasons, age, disability, or others, they're not able to do this. So the third modality is delivering the service itself. And that's what we call pharmacy practice, pharmacy care, right? And you can see the 4 priority work streams that we have identified for enabling this delivery, embracing people and helping them to embrace health as their priority, accompanying them in this journey, being a collaborative professional for other clinicians and other healthcare professionals, maintaining expertise in medicines. We are not sacrificing this in favor of other duties, and also gaining trust for expertise in other products. Let's take a look at the next slide for special asks that health systems have for pharmacists in certain situations. One of them is healthcare emergencies. I will not say too many words about this because many speakers gave tribute to pharmacists' role in curbing the COVID-19 pandemic. And this is a well-grounded testimony underlined that maybe some healthcare facilities even had to close or reorient to care for the acute cases. Pharmacists continue delivering care for chronic patients, right, and embrace this role of curbing the pandemic. This is an excellent practice, and we need that it becomes the part and parcel of the pharmacy practice so that pharmacists know how to do this and stay prepared for, who knows, next emergency. And then the second area is greening medical deserts. And I think our distinguished speakers also mentioned the special ask for pharmacists in rural areas. We have other underserved areas like underpopulated islands, mountainous areas. Yeah. What do we do there? There is a clear need to develop a framework for pharmacy practice and bringing not only products, not only the demonstration, but also the services closer to patients. And what enablers do we need? What we would like to ask health system to help us to implement this vision. Mr. Lorenzo has also already touched on 3 aspects. I will not repeat them, but I would underline some of the dimensions and maybe add to the list of the 3 key enablers that Mr. Lorenzo mentioned, right? We need to know what is our baseline starting point. We have an excellent example from UK where it was decreed that the minor ailments are the baseline competency of the pharmacist. We have another example from home country, Ukraine, where the entry point was a symptom and then an algorithm available for pharmacists defined what pharmacist is supposed to do next. Deliver the pharmacy care, refer, or do other actions. Right? In addition to this, we need quality framework as part of the regulation, right? Because we need to make sure that the quality level of the pharmacy care is acceptable. The enabling infrastructure, Thomas mentioned digital technologies. We also need to remember that service delivery requires confidence, right? And requires dedicated spaces in pharmacy. So the exhaustive list of the enabling infrastructure is needed. And also, as Thomas mentioned, patient pathways would be helpful to have. I will repeat what Mr. Lorenzo said about the importance of financing to make sure that pharmacy care remains sustainable and affordable. And when I say financing, I mean not only out-of-pocket payments, but all eligible payment mechanisms, including and maybe even primarily payments from public purses. And of course, the necessary skill set and knowledge of the pharmacist. Our colleagues from the pharmacy schools, from the universities, would also help a new generation to acquire them. Monitoring and evaluation, just to make sure that we have the data to demonstrate what we are bringing to the table, what contribution we as pharmacists are making. So at that, I would like to finish my presentation. Thank you for your kind attention and hand over to my colleague and co-facilitator, Dr. Catherine Dugan, maybe with a question. Do you think I'm asking too much of our fellow pharmacists and of our health systems, or is this doable? Catherine, over to you.
Thank you so much, Stan. No, never enough, never too much. We are always equipped to do more, and we are ready. Ladies, gentlemen, dear colleagues and distinguished friends, we are delighted to be here today. I'm the Chief Executive Officer of FIP, the International Pharmaceutical Federation. And on the eve of World Pharmacist Day, I just wanted to mention that FIP was founded on the 25th of September 1912. So you are here to celebrate the 112th birthday of FIP tomorrow. And on the shoulders of giants, we stand. And on the shoulders of giants, I would like to bring my next two panelists to the stage. And I welcome Rob and Dara before I introduce you. Come to the stage. And before we get going with our panel discussion, I'd like to say a few thank yous. In fact, it's all about thank you. A special thank you to everyone who has traveled far and near to be with us here today. We're really delighted to have you with us in the room here in Copenhagen. Thank you in absentia to the Regional Director of WHO Europe, Dr. Hans Klug, as well as to Dr. Natasha Azzopardi-Muscat, Dr. Thomas Zapata, thank you so much, and Mr. Stanislav Kineskov. Thank you so much for your challenges and for your cooperation. And to all of you at WHO Europe for this opportunity to co-host the event with FIP and for the great collaboration. Thanks also to the Minister of Health of Portugal, Professor Ana Paula Martins, the Secretary of Health for Spain, Mr. Javier Padilla, for accepting the invitation to participate in our co-event, and particularly in this panel discussion. Thanks, Luis, for your great presentation. I'd like to introduce Dara and Rob. So, Dara Connolly is a community pharmacist from Ireland and our FIP chair of the Board of Pharmaceutical Practice. Previously, Dara served as president of the Irish Pharmacy Union and president of the FIP Community Pharmacy Section, where he led the Vision 2025 strategic plan, Pharmacists at the Heart of Our Communities, a pretty important strategy for today. And Rob Moss was ratified as one of FIP's vice presidents just a mere few weeks ago at our Congress in Cape Town. But he's certainly not new to FIP. Rob trained as a hospital pharmacist in Haarlem, the Netherlands. He works as a consultant in hospital pharmacy and as a senior advisor on critical event preparedness for the Dutch National Medication Coordination Centre. Before taking on his current role as a vice president of FIP, he served as president of the FIP Hospital Pharmacy Section, and he is a current member of the FIP Technology Advisory Group. Today, the goal of this panel, if they accept it, is a discussion to address the policy enablers, the existing barriers that we all see, particularly post-COVID, but also some of the best practices of how pharmacists are contributing to healthcare delivery, particularly what we would describe as primary healthcare delivery across the European region and even beyond. And we know colleagues in the room have much to share as well. And if we don't have time during the panel, we will have time afterwards for discussions. As we prepare to celebrate World Pharmacist Day tomorrow, it's such a good opportunity to reflect on how pharmacists have been addressing the healthcare needs of individuals, of all our communities, and our health systems through a range of innovative professional services that lead to better care, to timely and accessible care, to the generation of value, and to relieving pressure on stretched health systems and facing health workforce shortages. Time is tight. We're already a little bit tighter for time than we might like. So some of the topics that we will put to our panel and I will target the questions to the panelists. You can all grill them afterwards with more questions. Will be about advancing the rational, safe and cost-effective use of medicines in hospitals and community, improving vaccine confidence, delivery and uptake, empowering self-care and managing common ailments in the community, providing timely care and reducing pressures on other healthcare professionals, GPs, for example, but also emergency departments, curbing AMR through appropriate antimicrobial stewardship, and preventing, screening, and managing chronic non-communicable diseases in the community. Quite a lot to discuss, and never enough time. So as I say, I have questions. I will ask the question, and then I will target it to one panelist, and maybe a second if we have time. We do need to be finishing our discussions around 20 past, 25 past, so I will keep us to time. And then we have some concluding remarks from Dara and from Natasha. So my first question, colleagues, are you ready, panel? There are often references to the need to expand the role of pharmacists. And we even hear it today, expand the role to include primary healthcare, to include services or medicines use optimization activities, for example. However, many of these services have been part of pharmacist roles now for years in many places. Maybe they have been invisible in many places, and yet healthcare systems sometimes fail to integrate them into the healthcare services. Maybe we don't leverage them as part of the patient-centric interdisciplinary care model. And Stan, you mentioned we should be putting the patient at the center. Pharmacists have been doing this for decades, if not centuries, I would argue. So I'm going to put this to Javier first. I'm going to be a bit provocative and say, what do you see as the main roadblocks to address this gap, this idea that pharmacy, and in particular community pharmacy, sits outside of healthcare and not integrated, that these new services are additional and new, when actually many of them already exist? Thank you, Javier.
Thank you very much. I think the main roadblock is related to the interprofessional reluctance to enable pharmacists, or in general, different categories, to develop the wholeness of their capabilities. I think we can see it. I'm a physician. I'm not going to be the one saying that physicians are not one of the responsibles of trying to not to grow the other competences of other professions. But I think that it is something, it's a problem of the system as a whole. So I think this reluctance should be tackled, should be addressed with an holistic perspective as a way of trying to change this skill mix in order to grow as a whole. So I think this is the biggest roadblock. But I think there is another one I would like to say, also in such a provocative way maybe, and it is that I have been hearing quite times talking about efficiency as one of the motives, one of the reasons to expand the role of pharmacists. But I think that every discourse based on efficiency is condemned to fail. Yeah. I think that efficiency should be as granted, but value added is the only way of moving forward to achieve this role. So, okay, it's more efficient, but it's not the why. Primary care is more efficient than hospital, but we don't have primary care because of efficiency. Yeah. Because of having the same physician for more than 15 years is going to reduce your mortality. So I think this is something that we should be adding to our discourse in order to arrive not only to population, but especially to politicians.
Oh, I'm very delighted you said this. So I'm going to hand the same question to Ana Paula. Ana Paula, you know, you're in a health ministry role now, but you're also a pharmacist through and through. Does this chime with you? What are the barriers? What do you think that we as a profession could do better to explain how integrated patients are to our service?
Thank you, Catherine. I fully agree with Javier. I think I would have one special topic that at least now in the last 5 months I've been, not just working but also thinking a lot. I do think that our systems, at least in Portugal, of course I do not know others so well as well, sorry, we are not putting enough or the right incentives in integrated care. If you do not put money there, and sorry for saying so direct, we will not have a patient-centered care approach, thinking in results that are, let's say, an addition of all the services that are provided by the multidisciplinary team. Just an example. We are now, again, that's the time for doing that in the NHS, for, defining all the objectives and results we need to achieve in 2025 with our healthcare units. And nowadays we have, a system where hospitals and primary care units are integrated. But in that discussion for the contract, for the financial contract, the objectives, for instance, for diabetic patients do not include other professionals than the ones that are already in primary care centers and hospitals. And I do think that we need to move forward, and I have responsibilities now for that, so I'm very cautious what I'm saying. We need a new contract with pharmacists, at least in Portugal, definitely. It's not, it's not only vaccination, which is a great achievement with excellent results. I think it's more than that. It's like a social contract for results, but thinking that 20 years ago would be completely different. Now we need to have this integrated care and pay for this integrated care. Yeah. Because the incentives will be divided for everyone.
And the benefits are
and the benefits for the patients, of course, are in the center.
Thank you so much. I'm going to move us to our second question now, and I'm going to focus on the vice presidents at FIP on this one. These services we've just mentioned deliver great value for patients. I think, Javier, you just mentioned it. It's not all about efficiency. It's about effectiveness, improved health outcomes, timely access to care, convenience, and to the health system itself with reduced pressure on primary health care, timely care, lower burden of disease. So it's a win-win. But we see the provision of these services by pharmacists needs to be more sustainable. It needs to be reliable through sustainability. And I'm going to go to Dara and then to Rob and Luis in order about what are your views on the most suitable ways to achieve sustainable services?
That's a very big question. What I can tell you when we're talking about the sustainability of the service is pharmacy as a profession over centuries has always adapted to new technologies, always adapted to new practices. But what has sustained pharmacy and pharmacists and pharmaceutical scientists over those years is our ability to listen to the people that we serve, our ability to adapt to their needs. And I think probably maybe in a little bit of a rarity within the healthcare space, we offer people choice. So a lot of the time when we talk about the services that we want to offer people, I think we need to look at it maybe from a slightly different perspective and to say that we wish to offer people choice in their own healthcare. So if we start the conversation by saying we can do a graphic and we can put a picture of a person at the center and then everything else, that really doesn't mean anything, Catherine, until people have choice and people have access to their healthcare. We have 4 core competencies as community pharmacists. We review medicines, we prescribe medicines, we dispense medicines, and we administer medicines. So it is a scenario, as we talk today about services that are available within the scope of practice of pharmacists, that we can actually see into the future. Because there is no service that we have spoken about today that is available to people at their choice, delivered by their pharmacist, that doesn't exist somewhere in the world already today. And what we're actually talking about is that we have seen the future, but what we're actually realizing is it's not evenly distributed. So to go back to the core of the question is, how do we sustain pharmacy and pharmacy services? I think if we maintain our relevance, and then we go and look to see that we can offer them safely, securely, and sustainably, there will be a future for the practitioner, because they will be able to see into the future and have the satisfaction of doing the best that they can for the people that they serve. But there's also a sustainability to that healthcare because it's accessible and it gives choice to people. So that is the virtuous circle that we need to have. But it has to be about thinking, about offering choice and access to people, that they should have agency in their own healthcare. And that's what true equality and equity of access is in healthcare.
Thank you, Dara. Rob?
Thank you very much. It's very well spoken. And I think I'm talking here as a hospital pharmacist, and I think in the one hand, we have a bit of an advantage. First of all, now I'm talking about hospital in the traditional way of a setting, which is a small microcosm in which you can experiment, and trust within healthcare professionals is easily gained. It's also easily lost, but so you have more ways to experimenting. So things we are doing like antimicrobial stewardship, anticoagulation stewardship, all these new services, we could gradually grow into them, and doctors were comfortable, nurses were comfortable. The good thing now is that this is still healthcare professional oriented, and it's now more patient oriented. And I think that is the interesting part, because now it becomes not just what do we do within that microcosm, but what happens to the patient when we go outside of that microcosm. Because it's relatively a short period, thankfully, that people spend in hospitals. We think it's a very important period, but it's a very minor part. And now it's about having those services beyond the hospitals and together with community pharmacists. And I think that's where we are. We managed our positions because we could measure results. We showed results, and that made other healthcare professionals and later patients confident in our in the work we were doing. And I think that is the point where we are now. We are not microcosms, we are health ecosystems, where people will have ecosystems for specific conditions. They have ecosystems in specific age groups, social groups, all these different ecosystems that you'll have. That's where we'll have to expand. And I think when we do the job that we do, and Dara has been telling us perfectly what our skills are, doing that and showing the people and being open to, people offering these services, but offering choices within these services, I think we're sustainable. And of course, we'll always mention the remuneration. That is part of it. I mean, it doesn't come for nothing, but it is health, it's efficient.
Yes. Lovely. And I think that feeds into the initial conversation you said, Javier, which is not focusing only on efficiencies. At some point, efficiency is doing nothing because it costs the least, whereas effectiveness on top is where we seem to be. Luis.
Thank you, Catherine. I'll have actually a different approach from my previous colleagues. Probably have a different view. Oh, thank you.
They didn't like that.
Being different.
No different views.
Let's go with the flow. When it's about sustainability, as a concept, it's the way that you use the actual resources and to prevail those resources over time. So that actually you can use it in a short period of time, in a way compromise the future. We can see that, and I'll come back also to what was mentioned by Javier and Apollo regarding the interprofessional connection. If you speak about a certain service, if you want it to prevail over time, to be sustainable, you need actually to understand the value. And what I've been seeing over the last couple of weeks, I'll share you a story, is that we do work a lot in silos. And I think it's cross-sectional, not only to pharmacy, within pharmacy profession, with other professionals. I attended the Dentistry International Congress 2 weeks ago in Istanbul. And to be honest, there were more things in common than actually different with our colleagues in dentistry, because they also felt that they work in silos. They didn't know what we're doing. I didn't know that. Well, I do know what my dentistry does, but I don't know what the rest of dentists do. But anyway, just to have this idea that's important creates a baseline or a cornerstone of trust. One of the beauties of being a professional secretary of FIP is that we have a blend of practitioners, scientists, and educators. And FIP just launched in Cape Town during our annual Congress a statement on interprofessional collaboration. I was able to chair that group together with the pharmacy educator, and it's impressive the amount of information that we have from academia about what are the principles, the guiding principles about actually having an interprofessional collaboration. We need to create trust. We need to understand the scope of practice. All has been studied. We just need to implement. And I will actually make a challenge all of you, because on that specific statement of policy, we don't focus only on what we at FIP have to do or what our practitioners have to do. We focus on academia. We focus on member organizations. We focus as well on our stakeholders and other professionals. So all of us have a role to play in this game, and that's the baseline of sustainability. And just a final note. We tend to think that we do work in a healthcare system or ecosystem, but we do have a lot of examples worldwide that patients are actually the driving force of sustainability. We have seen some jurisdictions adopting, for instance, a chronic patients renewal in pharmacies because patients were clear. We have gone through the process during the pandemic. We want to have implemented, and believe me, that was fast. And believe me, that was sustainable. So probably what you need to do more is to interact more. Not only here, it's a good start. And at the statement of policy, we say, work locally. Have you talked with your hospital pharmacist? Have you talked with our community pharmacist if you work in a hospital? Have you worked with our GP that's actually practicing in the area? Probably we do more for our patients if we do that. And wait also to FIP and other organizations do their part.
Thank you, Luis. Great comments. And this feeds very nicely into the next question I'm going to ask. And I'm going to focus this question really on Dara and Ana Paula. But I think I like this thread of collaboration. So for pharmacy-based vaccination, at FIP, we've seen an increase from 16 countries where this was possible in 2016 to at least 56 countries at the last count, beginning of this year, with 25 of those countries being in the European region. So that's a big increase. 47% of the entire WHO region has pharmacies and pharmacists involved in vaccination. Pharmacists have played a major role in bringing the pandemic under control. You mentioned this earlier in your keynotes, and are providing accessible and convenient pathways for vaccination, whether that's by people able to get a vaccination in a pharmacy or the pharmacist being the vaccinator. I think, really importantly, Portugal was an early adopter of the pharmacy-based vaccination in Europe and one of the first in the world in 2007, and soon followed Ireland in 2011. So Dara and Ana Paula, and I think probably I'm going to let Ana speak first. Can you comment on the positive impacts this has had in terms of vaccine uptakes and coverage in your countries? Any kind of feeling or experience or data that you have? And of course, the impacts are translated into the efficiencies and the economic terms that Javier mentioned for the countries: lower respiratory diseases, lower hospitalization, increased productivity, etc.
Katrin, I do not have numbers here, but we have some numbers. And National Association of Pharmacies have done a lot of, work just analyzing the data and going through all, these years and mostly during the pandemics on how efficient the vaccination done at the pharmacy is. But definitely let me go through topics as a politician now, what I am, at least for now. Let's see if I survive. But it's not easy to survive. Minister of Health has a very short.
Sure, we have a vaccine.
Yes, yeah. But again, what we see is first satisfaction. People are really satisfied for having the freedom to choose his or her pharmacy to go, and the plan, it's so much more, let's say, strong, because pharmacists, we started 3 days ago, and in the first day, I have numbers, 5,000 people were vaccinated for COVID-19 and influenza, and 70% were in pharmacies. And why? Because of this satisfaction, because it's convenient, and because the pharmacists started in June, July to plan, and to give slots to the citizens to going into the process. And I think this predictability is also something that the citizens, the people, mostly the most aged, they'll value a lot. Yeah. And for us in the government, any government, the last one, or the socialists, now we are the Social Democrats, it's the same, because what we want is that, our citizens are satisfied, but more than that, the coverage, a high coverage for the winter, that is very important. Yeah. So I tend to say that the third topic on this vaccination whole, experience for a long time already in Portugal, is that it's definitely more efficient. Yeah. Efficient in terms of, let's go to the price we pay, the public price we pay. If you make, your calculations in the public price comparison, which is something that we use for price equivalence. I will not tell exactly how much less we pay in the pharmacy for doing this. But the question, because of course there is, costs that we have already in the health centers, and we need is the cost of opportunity costs. We need to have our nurses and our staff in health centers doing this. Let me say something that is very important, and I think that we shouldn't, and I'll be very quickly, we shouldn't forget. Nurses have for a long time the exclusivity of vaccination. And there is some, let's say, beauty on that too. And we need, in our perspective, to join forces and not to divide our health workforce. Tensions are real until now, disappeared. Of course, now it's much more easy, but we have a way, not a long way, but we have a way forwards to do together. And I think pharmacists and nurses, in terms of vaccination, should try, and the government can help, of course, but should try to have some common goals. Otherwise, will be much more difficult, because when you are a Minister of Health or a Secretary of State or in the Parliament, you need to have balances.
Yeah.
You cannot go, against. You have to join people and put all your workforce working together in the benefit of the patient.
What I'm hearing there, Anna Paula, is all sorts of elements that feed the other. Oh, I had one for you, Dara. Imagine double mic. I will put this here. It's safer. I can see sustainability, but interprofessional collaboration, working together, shoulder to shoulder, not fighting, seeing the pathway ahead. It all fits together. It all has to be there. Dara.
I would see vaccination by pharmacists as being something that really exemplifies those 4 pillars of review, prescribe, dispense, and administer medicines that we have in the vision for Community Pharmacy 2025 at the Community Pharmacy section in FIP. Why I'm really passionate about it is it's something that I do. And I'm really proud that I was able to give options and opportunities for people to get vaccinated during COVID-19. And it was never going to be the case that there would only be one avenue in which to vaccinate everybody. So in Ireland, people had a choice to work through their general practitioner. And the most of the time, exactly maybe as Ana Paula is saying, in Portugal, those vaccines would have been delivered by nurses in GP surgeries. They would have been delivered by nurses, pharmacists, veterinarians, opticians, dentists in vaccination centres, which was a real example of collaboration at a time when it was needed in vaccination centres. And of course, then when we had enough vaccine to go around, people were then able to come to the community pharmacy to be vaccinated. One of the things that proved really, really beneficial, and it wasn't something we knew would happen until it rolled out, people who were vaccine hesitant found it easier to come to a community pharmacy because it was, for want of a better term, it was demystified or demedicinalized. So if you're somebody who's vaccine hesitant or really hasn't paid a whole lot of attention to healthcare and how healthcare systems work, the worst thing that you can say to that person is, you need to get a bus, you need to go 30 kilometers up the road, then there will be a second bus that will then bring you to the vaccination center. You don't know who's going to be there, who's going to vaccinate you, what they're going to say to you, and then when you're done, you come home. And what we want you to do as well then is take a day off work to do that. So the beauty of what we discovered through vaccination in community pharmacies, people who were hesitant or people who were immobile or people who were not time rich had the opportunity to get their vaccine in a community pharmacy. So it was never going to be the case that it was going to be 50% or 30% or 20% because of how we had access to stocks. So I know that in France, 50% of COVID vaccinations took place in community pharmacies. What I found really beneficial about it from a policy perspective, it actually showed that those 4 pillars work so well together because it's only by levering the other 3 do you get the benefit of the 4th. When we then talk about remuneration, no community pharmacy could exist on the payment that comes from vaccination. No community pharmacy can exist just on the payments that come from dispensing medicines. And as we start to talk about new services like vaccinations or emphasizing reviewing and prescribing by community pharmacists, we can't forget that our core function always has been and will remain for a long time the dispensing of medicines. So if it's a case that somebody wants to come along and see something that's new and shiny and fandango and go, this is brilliant, we're going to pay pharmacists to do this. Where we find ourselves around the world is that we need to have a fuller conversation with our payers to say that because there are 4 pillars, you can't start to unpick those 4 pillars because otherwise we're not actually providing the holistic service that gives us the ability to provide a holistic service, which is then going to be sustainable and then will offer choice and access in our communities.
Thank you, Dara. I told you, colleagues, there was never going to be enough time. I was very tempted there to ask another sneaky question, but I do realise we have to do some roundup comments, and then we need to have the opportunity for you all to be talking in a more casual, informal way over our posters. So I'm going to move us to the conclusions and the closing remarks. May I just say, though, that much of what you've just heard has touched on the empowering self-care and managing common ailments, because this is what happens by conversations in a community pharmacy. We haven't had chance really to talk about AMR and AMS, so I'm going to push you all to talk about that to your fellow colleagues. And then also preventing, screening and managing NCDs is part and parcel of what everybody does in pharmacy. May I also say the NCDs that aren't listed in the top 5 are bread and butter in community pharmacies. So a big thank you to our distinguished panel for this discussion. We could have had 3, maybe 4 more hours. I definitely could have, especially with my headpiece, with my microphone. I think I will wear this all evening. It looks like the pharmaceutical profession can offer much more to the health system, and I think our colleagues, Secretary of State and Health Minister, will be much comforted by the opportunities pharmacy can provide. I specifically wanted to underscore one aspect, and that's the interdisciplinary collaboration. Thank you, Louise, for bringing our minds to this. We can't do this on our own. Medics can't do it on their own, nurses can't do it on their own, and pharmacists can't do it on their own, and dentists and physios and all the other health professions as well. And actually, we don't need to fight. We can really go further together. That phrase, we've just come back from Cape Town, you can go fast if you go alone, but you can go further if you go together. It's very, very pertinent right now. I also think it's really important for us to think about how we can support our people, our profession, but also our people, our communities in preserving and restoring their health. And may I say, some of the conversations we had with Stan and Thomas and Natasha virtually was around mental health of our profession and improving what we might call resilience, but actually I think it's just about caring for the profession that we have, who did such a good job. So, Dara, I would like you to outline for our audience here today the key takeaways from today's symposium for you, and then I will hand over to Natasha for her concluding remarks virtually. Dara.
You've given me all the easy jobs this afternoon, Catherine. Thank you very much. I think the big takeaway for us is that we are all so single-minded, whether we are WHO, whether we are FIP, whether we are WANGA, it doesn't matter what the organization is. The focus that healthcare professionals have is delivering healthcare where it's needed, and having fascinating conversations with people today and throughout all my travels when it comes to international pharmacy and healthcare is how passionate and how people care about other people. I think what we need to do is to stay focused on offering that choice and that accessibility to the people we serve. And probably if there is a takeaway, and it was something that struck me very much to my core when we were in South Africa listening to a pharmacist from Ghana, and she was talking about going out and finding people who are invisible and making sure that they can get healthcare as well, because we can spend too much time talking about the people who are already in the system. I think if that we work collaboratively and we offer choice and access, and maybe if we can as well demystify what good healthcare is and how good healthcare works, I think we can get more people in to the healthcare family and the healthcare ecosystem earlier in their lives, which is that shift to the left that we want to see, closer to health, having healthcare closer to the person and their homes, which technology is bringing us to anyway, because I think that's the only way that we're going to have a sustainable healthcare system, if we maintain that focus on the person and making it as easy for them as possible to access quality healthcare.
Thank you, Dara, very much. And I wanted now to allow our colleague, Dr. Natasha Azzopardi-Muscat, the Director, Division of Country Health Policies and Systems, WHO Europe, who will hopefully be able to join us virtually. We know that she's there. Dr. Natasha, it's time to close this high-level discussion in this room. The conversations will continue. What would be your concluding words for the policymakers and healthcare professionals in the room here, but also including pharmacists in the WHO Europe region. We have Dr. Natasha.
Good afternoon. I hope you can hear me.
We can. Wonderful.
I've been here all the while. What a fascinating discussion. But for some odd reason, I'm unable to turn on my video because the host has stopped it. So I've been here just quietly in the background listening to you all. And I must first apologize for not being able to be with you in person. I'm actually in Gastein at the European Health Forum. Okay, now I'm allowed to turn on my video. Here I am. And in a way, this is symbolic because a year ago, when Thomas and I were presenting here in Gastein on the healthcare workforce, we were called out by a young pharmacist at the back of the room. Thomas, I'm sure you remember. And we were challenged. And we were told, today is World Pharmacist Day, and nobody ever talks about pharmacists. And I spoke to the colleagues, Thomas and Stan, and I said, look, next year we are going to mark World Pharmacist Day, and we're going to reach out and we're going to make sure that we don't overlook this profession, such an important profession. And since then, as you know, we've been working closely together, and I think that today is really a milestone. I was delighted also to be able, with the support of the Lancet Regional Health, to have the commentary published in time too. And then, as I was sitting here listening, it's been great to hear the messages that have been delivered by Honorable Minister, who is a pharmacist herself. We had the pleasure to meet in Porto at the beginning of summer. And of course, Dr. Padilla, we were in Madrid just earlier this week. And all of you who made such important contributions. I think none of us sitting online this afternoon or in the hall at UN City have any doubt at all about the value of pharmacists and the pharmacy profession in modern day healthcare systems. None of us have any doubt at all that pharmacists are trusted experts, not only in medical products, but also in delivering care as part of the healthcare system. I was delighted to hear so many references to pharmacists who work at the primary care level, but far too often, when people talk about multidisciplinary teams, I see pictures and pharmacists are missing, oftentimes because they don't physically sit in the same centers, because they sit in the pharmacy, which may be situated just on the opposite side of the road from the doctor's clinic or primary care center. Out of sight, out of mind, absolutely. And we have to keep reminding people that pharmacies and pharmacists are a quintessential element in the delivery of primary and community care services. And increasingly, in many parts of our region, the pharmacy is really the last point of contact left standing, particularly in rural areas. But I was equally delighted to hear, for example, of the roles that pharmacists are taking on in hospitals, not only, for example, in complex areas such as the administration and preparation of cytotoxic and immunologic treatments. But last week, we celebrated another day, Patient Safety Day. And tomorrow, actually, one of the sessions in Gastein will be focusing on quality of care. And we know, we have the evidence that when pharmacists are in the teams, embedded on the ward floors, as part of the team, at hand, providing advice, checking patient files and records, outcomes are better because we avoid harm that often comes from inappropriate or oversight use of medication. So the pharmacist's role has evolved, but needs to continue to evolve. And of course, we've heard about vaccination, we've heard about the important role that pharmacists can play even in providing tobacco cessation advice and access to products that can be used to assist monitoring of blood glucose, hypertension. But one of the things that I'm always very, very wary of, and I've used this also in discussions with nurses, is that I shy away from the concept of task dumping. I think I heard Catherine say during the meeting, pharmacists are overwhelmed, are overworked. It's not so straightforward when we talk about the expanded role, unless we change some things and unless we make space for us to actually take on these roles which are important. So I'm just very mindful that the narrative that we use should not come across as task dumping, which is what I like to call task shifting, but are at actually fulfilling roles that make sense, that fulfill a need, and that play a rewarding role for the pharmacists, and more importantly, provide access to quality services for our patients. So I believe that, as Thomas has rightly pointed out, at a time when we are trying to move away from health workforce crisis to solutions to a sustainable health workforce, we just need to ensure that pharmacists are at the table, round the table, and are firmly in our minds as WHO when we go into countries, but we need to work together to make sure that also policymakers are recognizing. And I think that today's event, the run-up to it, and the follow-up that will ensue is just a small but important step that we have taken in this direction. I'm very proud of what the team has pulled together. I'd like to thank all those who traveled for the event, particular Minister and Deputy Minister. And of course, I'd like to thank FIP for having put your trust in us and for having committed to continue working with us, such that today is not a one-off event, but really starts to chart a path where we can continue to work together to improve universal health coverage across our region. So thank you very much, and I hope to be able to see you again soon.
Lovely. So before I hand over to Stan, I think you're going to do the final remarks. I just want to say a few thank yous from my perspective. Just please join me in thanking Ana Paula, Javier, Luis, Rob, and Dara for sitting here and taking my questions. Can I also do a big plug, Natasha? We want you to have pharmacists on your lips at every moment. Pharmacists are ready to work shoulder to shoulder with health systems and other healthcare professionals in delivering care. And we need policy makers everywhere. When they think of health, they think pharmacy, wink, as our campaign says. I've made my president very happy by making that link. And after the event, I would like to invite you to visit the showcase of posters. Many of you in the room have delivered posters in the Atlantic Lounge, where the roles of pharmacists in many areas are described. I have the pleasure of inviting you to a reception in the same lounge where we can all continue our conversations, some of us without microphones. And I'd like to thank two organisations, Association of Pharmacists and Pharma Denmark for their collaboration and generous support in organising our reception, and our academic institutional member, the School of Pharmacy and the University of Copenhagen, and to the volunteers, Thomas, you mentioned the pharmacy students. I'd like to give a special thanks to our FIP officers, Raquel as well, our FIP officers, and we don't do things on our own at FIP. So a big thank you personally to Gonzalo Sousa Pinto, the FIP program lead for practice transformation, and to Carola van der Hoof, who will never let her star shine too brightly, our Congress Director and COO. Both of them are in the room. And finally, all of those who have birthdays today and in recent days, let's just join together to say happy birthday to FIP and happy birthday to everybody. Stan, the floor is yours.
Thank you so much. Now, all I can do is just echo what Catherine has just said and thank all the colleagues who are present here and work tirelessly to make this event possible, our distinguished panelists and our partner the International Pharmaceutical Federation, and also our collaborating center, the School of Pharmacy of the University of Copenhagen. I just wish to conclude by wishing happy birthday to FIP and a very good World Pharmacy Day tomorrow to all fellow pharmacists across the region and beyond. Thank you very much.